Welcome to the Protecting Your Nest podcast. The S in the NEST acronym has two meanings: less stress and more sleep. Today, we will spend some time talking about how important your sleep is in helping you achieve your health related goals. Dr. Michael Breus is a clinical psychologist and diplomat of the American Board of Sleep Medicine, as well as a fellow of the American Academy of Sleep Medicine. Dr. Breus is a clinical advisory board member of Dr. Oz Show, and author of the book entitled The Power of When, a groundbreaking biohacking book proving that there is a perfect time to do everything based on your hidden biological chronotype. His second book, The Sleep Doctor's Diet Plan, Lose Weight Through Better Sleep, discusses the science and relationship between quality sleep and metabolism. I could go on, but instead, let's get started as I welcome you, Dr. Breus, to Protecting Your Nest.
Thanks for having me. I appreciate it. I love the idea of protecting the nest, right? Like the nest is like the bed, the bedroom. I love that. So much
That's
fun.
right.
So I'm excited, brother.
I appreciate you. It was made right for you, and I appreciate you. And actually, I found you as I prepared to write an article with the Diet Doctor. I have what is entitled the Low Carb Corner on their site, where I share principles related to this nest and rope acronym.
Oh, cool.
So it's really cool. That article that I wrote was on sleep, and it was entitled Prioritize Sleep for Weight Loss and Health, which was released on March 19th.
I love it.
And ironically, I didn't even know it that it was on World Sleep Day. I really didn't find out until after we released the article. Can you believe it? Couldn't believe it.
Good timing. You were
Good timing.
tuned in, my man. You were tuned in.
It was the universe. So, but that inspired me also to contact you because I actually did some research on sleep, and your name popped up. So let's start our conversation by you telling us how you became a sleep expert.
Sure. So I have a PhD, as you said, in clinical psychology, and I am board certified in clinical sleep disorders. So that's a little bit unique. So let me kind of double tap on that one and break that out for people. So while I have a PhD, I actually am medically board certified. Wait a second, Dr. Breus, how on earth did you do that? So I'm the crazy guy that took the medical boards without going to medical school and passed. I'm one of 168 people who have ever done something like that. So yeah,
Oh, that's crazy.
it is super crazy. To be clear, I'm not some super genius. I'm just a good test taker. But I spent my entire career, 23 years, specializing in sleep. And so the goal here was to take my learnings from being a PhD clinical psychologist and understanding the psychology. And then the sleep aspect, I became an insomnia specialist primarily because, insomnia has so much to do with mental focus, mental health, anxiety, depression, things of that nature. I started my career, oddly enough, just as a general sleep doc, working with a group of pulmonologists. And we were seeing, I was seeing 30 patients a day, reading 15 sleep studies a night. I mean, you know the drill, right? It's clinical medicine, right? I did that for 6 or 7 years. And to be fair, I got kind of bored. When you're a sleep specialist, you pretty much treat 5 things over and over and over. Apnea turns out to be the biggest one of all of them. I felt like, gosh, I was really interested in affecting more than just 30 people in a day. A friend of mine who had a job at a company called Medscape, which eventually became a company called WebMD, asked me if I was interested in maybe participating with WebMD. So this was very early in my career, and I was excited to do it. And so I became the WebMD sleep expert. So I guess that's the first time that I ever became the quote sleep expert that was out there. And to be fair, it was fun. I like doing it. I'm a little bit of a ham, as you can probably tell. And so I like doing media. I like creating content. I like having discussions, I like mixing it up with people and saying, hey, let's talk about some ideas. Let's figure out a way to be healthier. Let's all grow together. My presentation style, while it's unique, appears to be something that people like. And so I started doing a lot more television work. And so I was very fortunate. Dr. Oz was nice enough to have me on his show 40 times. 40. And then I do work with the doctors. I do work with Rachel Ray. I do work with most of the morning shows, the Today Show. Carson Daly is a patient of mine. I'm allowed to say that. He lets me say that. out there. So being the quote sleep expert, honestly, the expert part hasn't been as interesting, but the learnings and the sharing of the education part has been the most fun for sure.
Yeah, you're awesome. I didn't master sleep. I wouldn't say I've mastered it because I'm going to learn your principles and incorporate them. But I've got much better with sleep over the last year, and it was a game changer. So, as a
It's
doc who
huge.
focuses on metabolic, it's huge, and that's why I want to ask this next question.
Sure.
I focus on metabolic health. And I recognize there are many ways to achieve your goal. I've always felt that diet was like the number one priority. And that's why in my nest, that's the N is number one, right?
Right.
However, I know that you're a sleep doctor. So I want you to make a case
I
why
will.
I should prioritize sleep more than the nutrition, exercise, less stress, et cetera.
100%. So let's take the example that you were just talking about, which was weight loss,
Mm-hmm.
right? So let's talk about that in particular, because I did write a book called The Sleep Doctor's Diet: Lose Weight Through Better Sleep. So I have a pretty good understanding of how sleep deprivation affects the metabolic cycle, right? And so the first thing we got to do is we have to define what is sleep deprivation, because it's different for different people, right? And so as an example, I go to bed at midnight. I wake up at 6:13 every single day. That's me. That's just what I do. Okay. Clearly, I'm the sleep doctor and I get 6 hours of 13 minutes of sleep. How does that work? Well, I'll explain that in a minute. My wife, on the other hand, goes to bed at 11 and she wakes up at 7. She gets roughly 8 hours of sleep. If she got the amount of sleep that I get, she would be sleep deprived. It's an individual principle. Okay. So everybody's sleep deprivation is to their own. You have to know and understand how much sleep your body needs before you can decide if you're sleep deprived or not. Let's just say, for example, you're pretty sure that you're sleep deprived because you're exhausted all the time, you're yawning all the time, blah, blah, blah. Okay. Michael, what does this have to do with metabolic function and what does it have to do with weight gain? It's pretty interesting. So, the moment that you become sleep deprived over a chronic scenario, so we're talking about more than 3 days, several things happen. Number one, from just a pure metabolic standpoint, you become insulin resistant, which is very interesting in and of itself. We can actually, with
Mm-hmm.
sleep deprivation, I mean, you know the data, dude. It's crazy. We can throw somebody into a very bad state with just sleep deprivation from a sugar standpoint. But it gets even more interesting than that. As soon as we become deprived, our brain says, "Oh crap! Why are we still awake? We need to find resources. We need to find more food." And so it increases appetite.
Mm-hmm.
Okay. So that's number one. The second thing it does is it says, hold on, I've only got so much in the tank. I'm going to slow the metabolism down because I need to go find more resources. So you've got high appetite and low metabolism. Right there, it's kind of bad, but no, it gets much, much worse. There are these two hormones. One's called leptin, the other's called ghrelin. So ghrelin starts with the letter G, and when I think of the letter G, I think of go, and that's what ghrelin does. Is it makes you eat. So ghrelin is the go hormone or the hunger hormone. There's actually a difference in your brain between appetite and hunger. Many people don't know that, but they're two different functions, and this specifically affects hunger. In fact, the hormone raises by almost 20%. So you're 20% more hungry when you're sleep deprived. Leptin is a very interesting hormone, as you well know, because it's the feeling of satiety or the feelings of fullness that actually reduces by 15%. Hold on a second, Michael. So my appetite is high, my hunger is 20% more in overdrive, my feelings of fullness are 15% less, and my metabolism is slowing down. Oh no, but wait, it gets even worse. So here's what's even more fascinating. As you continue the sleep deprivation, what ends up happening is cortisol levels are high, right? Because you're awake and your brain is like, why am I awake? And so you got a lot of cortisol running in your head. To be clear, your brain doesn't like a lot of cortisol running around in it. It causes tremendous amount of fatigue. It causes inflammation. It causes all kinds of massive problems up there. Okay, Michael, well, what do we do? Well, we need something called serotonin to help calm us down. You know what the easiest way to get serotonin is? Eat a Snickers, right? Grab a muffin, right? High sugar, high fat foods, which is what we crave when we're sleep deprived. It's because we want our brains to create the serotonin to calm us down. This is why we call it comfort food,
Gotcha.
right? Like mac and cheese just blows your brain out with serotonin, right? And so that's why those things happen. And so When you take all of this combined together, right? When you become sleep deprived, your appetite is high, your hunger is high, your feelings of fullness are low, your metabolism is low, and you're craving high fat, high sugar foods. It's a freaking disaster.
Wow. It
Wanted
is.
me to
And
break it
by the
down.
way, you just happened. Man, you did it. And Snickers, that's just happened. I can never keep those little mini Snickers like for
Oh,
Halloween.
yeah.
It's a nightmare. I can't. You walk by it a couple of times, but you just can't stop. So we have a rule for Halloween. We buy the candy 2 days before, and the
Mhm.
last kid gets everything. So it's like so, but thank you for that. I felt like I was going to obesity school. I didn't know much about ghrelin and leptin until I did my obesity board. So I appreciate you connecting those dots. I think that's awesome. I'm going to give a little teaser. We actually made a brief video, guys, about when's the best time to have sex. So I want you guys to look for that video. It should be out around the same time of the podcast, and I want you to check that out. So I'm going to tease you with that video on YouTube, and you should be able to check that out. I do want to ask you, I know your book, The Power of When, helps us understand the importance of knowing our chronotype. Didn't know much about that word until I heard you speak about it. So what's a chronotype? And once we know what ours is, how do we apply that knowledge to improve how well we sleep?
Sure. So, great question. So, a chronotype is so many people may not have heard the word chronotype before, but you've actually heard of the concept. If anybody's ever called you an early bird or a night owl, those are chronotypes. So, way back in the 70s, a group of guys got together and they made a questionnaire called the Morningness Eveningness Questionnaire, the MEQ. And it was able to evaluate some people were morning people, some people were night people, and then some people were kind of in the middle. They got these monikers of early bird and night owl. And then the middle group, they were actually called hummingbirds, believe it or not. This kind of went through the literature for a while, and people started doing all kinds of different studies looking at the differences. It turns out that this is a genetic issue. This is not a choice. You do not wake up one day and say, oh, I want to be an early bird, or oh, I want to be a night owl. If I look in your DNA and I look specifically for a specific SNP, which is called a single nucleotide polymorphism on the PER3 gene, when we see the flip, that's one of the things that sends you as an early bird or sends you as a night owl. My contribution to the literature is I found a fourth chronotype that's genetic, which is pretty interesting. I found a genetic chronotype for insomnia. As you would imagine, being the insomnia guy, that was kind of the area that I was most interested in looking at. And so, and part of the reason that I discovered it was based on a patient. So I have a patient that came in, and to be clear, I failed miserably. I was trying to counsel her for insomnia. We were trying to do everything, and it just didn't work. And so I said to her, I said, come on in, let's talk some more. So we sit down and we really take an even more detailed history. And she turns to me, she says, Dr. Breus, if I could just go to bed at 1 o'clock in the morning and wake up at 8 and go to work at 10, I think everything would be fine. I don't think I'd have a sleep problem. And so it sounded to me like she was this extreme night owl, right? And so I said to myself, all right, can I call your boss? So I called her boss and she said to me, she said, you can call him, but he's about to fire me. I'm like, come on, who knows if that's really true? Called her boss and I said, hey, Dr. Breus, I'm working with so-and-so. And he said, yeah, I'm firing her at the end of the week. That's how he started the conversation with me. And I said, well, I'm here to tell you that I think we've got a situation here. Would you allow her, instead of coming into work at 7:30, would you allow her to come and work at 10 o'clock? And then she'll stay the additional hours. And he said, sure, I don't care. It's her last week here anyway. I said, great. I called him on a Monday, called back on a Friday. And I said, how did she do? He said, first of all, she's keeping her job. Second of all, he said, I have a whole bunch of employees that I'd like to talk to you. Right. And so what became very valuable to me was understanding this concept that this human was in a different time zone, if you will. Right. And when I brought her in and she was so thankful and she said, I've noticed that there are certain times of day that I do things better than other times of day. Right. And you've probably noticed this, right? Because if you're a runner, if you're an exerciser, if you're a reader, if you're a creator, whatever it is, hey, I'm in the zone, or there are certain times when I can really do that. And then it kind of dawned on me. I was like, well, shit, it's all run by your hormones. So if I know the hormonal pattern right? Because it's very consistent. I can actually predict things. And so once I learned that there were early birds, people in the middle, night owls, and insomniacs, I created an online quiz. Now, I could just test your blood work, test your DNA, and that's one way to do it. But to be honest with you, that's expensive and it's hard to do and things like that. So if people go to chronoquiz.com, and we'll put that website in the notes later, chronoquiz.com, in about 2 minutes, you'll take a bunch of questions and you'll figure out exactly what your chronotype is. And then this is where it gets so cool. So remember how I said before that I go to bed at midnight and I wake up at 6:13 every single day? It didn't start like that. So I'm a night owl for sure, right? I mean, it's crazy how much of a night owl I am. When I went to bed at midnight, this was starting about 3 or 4 years ago, I'd wake up around 7:30 without an alarm. And then after about 3 months, it was 7:15. And then after about 3 months, it was 7 o'clock. And then after it's 6:45. And now I'm at 6:15. Going to bed and waking up at the same times every single day actually condenses your sleep schedule. Because if you're not in your chronotypical swim lane, your body has to get other sleep to just catch up to get to the chronotype sleep. So when people find this lane that works for their hormones, everything works better. Like the entire freaking body works better. It's unbelievable.
I actually have noticed that because, like, we were saying at some point, I don't know if before we started, but I actually sleep much better now because but that's what I've noticed when I'm on a schedule and I'm doing a good job.
Exactly.
I seem like I need less sleep. It's so weird.
Exactly.
So
it's all about the consistency because your brain doesn't think about it like this. Your brain is humming along, going, and then all of a sudden it's in a dark room and it's quiet.
Right.
Yeah,
like,
why did that happen?
Right.
But if your brain knows every single night at 11:30, it's going to go into that dark room, it prepares for it, it understands it, and then you do it better.
Such an easy thing to do, just being
seems like a pretty
consistent.
simple
So I
concept.
appreciate that. You would think, right? Yeah. So, we also have another teaser. We did another video entitled Tired and Need a Quick Revival. Try this hack. So I want you guys to go to YouTube again the weekend that this podcast released. So you'll have a video about sex and you'll have a video about how to revive yourself. You'll probably need that after sex, but that's just me. So let's get to the heart of the conversation. A lot of people listening probably want to focus on tips to prepare their bodies for adequate sleep. So maybe we can start to focus on things that we can do during the day to prepare ourselves. So what kind of things would you advise us to do during the day so we can be more prepared for sleep at night?
Absolutely. So there's a couple of different ways I think we can look at this. So what I'd like to do is start in the morning. So right after we sleep to prepare ourselves all day to be able to sleep at night. So the very first thing that people should do when they wake up in the morning is they should hydrate, not caffeinate. So let's talk about that for a second. So people don't know this, but sleep in and of itself is a dehydrative event. So you lose from the humidity in your breath and breathing out all night long, you lose almost a full liter of water every single night. Okay. So that in and of itself is an issue. Now, most people, there you go, water. Most people will actually grab a cup of coffee. Coffee is a diuretic. Remember, caffeine makes you pee. This is not the thing that you want in a dehydrated body. So when you wake up in the morning, you should have somewhere between 15 and 30 ounces of water. Okay. Drink it. Don't complain about it. Just drink it. Okay. It's good for you. It'd be great if it was in a recyclable glass, and it would be great if it was filtered so that you know the pH in it and things like that, which would be good for your body. But even if you don't know any of those things, drink the damn water, please. Okay. That's number one. The second thing you should do is get sunshine. What are you talking about, sunshine, Dr. Breus? Why do I need that? Remember something. Our brains are continuing to produce melatonin in the morning time. This is why we get what we call brain fog. Okay. So when you get sunlight, when sun hits your eye, specifically blue light, hits the melanopsin cells in your eye, it sends a signal to your brain to turn off the melatonin faucet in your head. Okay. So sunlight equals no more brain fog. So when I wake up in the morning, I have a glass of water and I walk outside and I get 15 minutes of sunlight. I do not wear sunglasses, but I do not look directly at the sun. I play with my dog, which is actually a really good idea as well. So, unconditional love first thing in the morning from your animal is probably one of the best things that you can do to wake up in. And it gives you a great way to start your day, right? And you're outside breathing fresh air, getting sunshine, drinking water. It works.
What about this thing? Is this any good?
Is that a blue light?
It's a
What is that?
mood. It's a light. Yeah. What's
So
your thoughts
these are
on that?
great.
Because I did that.
Mhm. So those are great to use when you wake up early and the sun isn't out yet. So now that we've
Yeah.
changed, with the times clocks, especially people in the Northeast are going to see a lot grayer mornings and things like that.
Mm-hmm.
So if you
Mm-hmm.
cannot go outside, I apologize. I live in Southern California. It's sunny here every single day. It's amazing.
Don't
I love it.
brag. Don't brag.
I know. I know. But what I can tell you is those light boxes work quite well. But if you can get water and
Okay.
sunshine early in the morning or light in the morning, that's going to be helpful. Number two is understanding when to eat. Okay. So everybody has different types of diets that they follow and things that they want to do, schedules and things like that. But when you eat turns out to be incredibly, incredibly important. And that has a lot to do with weight gain or weight loss. Now, we can have a whole discussion about intermittent fasting and that kind of thing as well, but that's really not my biggest area of expertise. What I can tell you is when we look at diets across the board, there's certain diets that are better for sleep than others. As an example, if you're interested in keto or paleo, which is more of a carnivore diet and less of a carbohydrate diet, there are some issues with that because in the very first few weeks, people get very alert and their sleep dumps. We call it the keto
Mm-hmm.
flu, and it happens to a lot of people. So you need to be aware of that. Vegetarians and vegans do reasonably well. However, protein definitely helps with sleep. So, making sure that you have enough good protein sources as a vegetarian or vegan, as well as making sure that you get enough vitamin B, enough magnesium, enough iron, you'd have to eat a bushel of kale to get enough magnesium these days. So many people, especially vegetarians and vegans,
Mm-hmm.
are needing to use supplementation in order to have all of those vitamins and minerals inside of us in order to make it work, right? Across the board, though, the one diet that seems to be the best for sleep is the Mediterranean diet. So if people are not familiar with that, this is one that's high in olives and olive oil and high fatty fish like omega, like salmon, tuna, avocado, things of this nature. And so this is a diet that seems to be the best overall for being able to not only fall asleep, but to stay asleep. Now, when you eat this meal turns out to be important, right? As you know, right? I wrote The Power of When, so I'm going to talk about when you should eat. Remember, you shouldn't go to bed too hungry, but you shouldn't go to bed too full either. And so remember, the body was not meant to digest food lying down. It was meant to digest sitting or standing. So you don't want to have a large meal too close to bedtime. That being said, there's a lot of problems that people have with blood sugar in the middle of the night. One of the things I've noticed is I have a large percentage of my population that wake up somewhere between 2 and 3 o'clock in the morning. It's always a very particular time, but somewhere in there. What's interesting about that is exactly the point in time where your core body temperature begins to rise again. And so your arousal threshold is much lower and it's easier to arouse from sleep. However, if people have not eaten since about 6 o'clock, their blood sugar is almost bottomed out. And so what happens is your brain says,
Mm,
there's no blood sugar. So it spikes cortisol to get you
that's
and it
right.
wakes you up. So one of the things that I've discovered is guava leaf tea. Now this is interesting. There's at least 2 studies to show that guava leaf tea, a cup before bed, actually keeps your blood sugar stable all night long. It's pretty fascinating when you think about
Cool.
something like as simple as guava leaf tea to be helpful with that. But the other thing is, remember,
Right.
have a whole food meal as your last meal of the day. And you want to probably have stopped eating approximately 3 hours before bed. What do I mean by a whole food meal? Stay away from processed crap, stay away from sugar, right? Especially at the end of the day, because it's all going to turn straight to fat. Like if you have to eat some of that bad stuff, you want to do it earlier in the daytime for sure, so you get the opportunity to maybe work some of that off. Me personally, I'm an intermittent faster, and so I have a feeding time, and I keep that very, very
Yeah.
consistent. Once again, consistency is key, even with your diet. One of the things I tell people all the time is mealtime turns out to be a circadian pacemaker. So if you eat at the same time every day and you sleep at the same time every day, your body works better.
I love it. And I was actually looking over at it's a little too far for me to grab, but I got those glasses that you
Oh,
can
the
put
blue
on
light
at
blocking
night to
glasses?
block the blue light. So I'm curious about, okay, we've covered some daytime things. What about at night? What can I do? And I look crazy. I look like a rapper with these,
Come
shades
on,
on.
you don't look crazy. What are you talking about?
I
I got
do look
some
crazy
myself.
in those
I'll show you
things.
mine.
You got some?
Of course I
Yeah.
do. I
Yeah.
got these
Looking
bad
good.
boys.
Yeah,
I
you
think
look
I look
real.
like Elvis Costello,
Yeah,
maybe
a little bit, a little
Bono,
bit. I would
little
hang with
Bono
you.
action, maybe. I don't know. We'll see. Right.
That's right.
So here's the question: like, do these things really work, and what's the
Right.
deal with them? Okay.
That's
So
right.
number one, full disclosure: my children are gamers, and they were like blue lighting until they fell asleep. I actually developed my own line of blue light blocking glasses. So if you
Really?
go to sleepdoctorglasses.com, you will see them. So full disclosure, I
Cool.
make my own lenses, but I'm going to explain to you why, and then I'm going to talk to you about what you can look for if you decide to get glasses. There's three things that are important when you wear a blue light blocking lens. And remember, this blue light is the same blue light that wakes you up in the morning. We want to prevent that from happening in the evening time. So that's why we wear these lenses. Number one, the lens itself has to be coated so that it blocks the particular frequency of light that we call blue. This is between 460 and 490 nanometers, just technical stuff.
Mm-hmm.
Number two, we must have an amber color to the lens. Now, this has been very controversial. Many people are now making blue light blocking glasses with clear lenses. It does not help you with brightness. There are three things that you must have in terms of blue light blocking. You must block the frequency, you must lower the brightness, and you must look at the angle in which the light is adjusting to the eye. And that's why when you have a glasses, you want something, where'd I put mine, that actually wrap around a little bit and really cover the sides, because then you're not getting aberrant light that's coming in from different places, making the lens themselves ineffective. Now, to be clear, you don't have to wear goggles. Glasses are fine, but you do want to get the ones with the amber lenses. And so one of the things I do is I put them on my kids and I put them on myself about 90 minutes before bed. That's very helpful for me because it lowered, but I can still see. So they're light enough where I can, if I want to read a book, if I want to watch TV, if I want to have a conversation, that's fine. The other thing that I do that I think your listeners would benefit from is I take the last hour before bed and I call this my power down hour. And I chop it up into three 20-minute segments. So 20 minutes for just stuff you got to do. So in my case, it's getting the kids' backpacks together, finding shoes, sports equipment, like all the normal parenting things that you kind of got to do, right? 20 minutes for hygiene, right? So brush your teeth, wash your face, take your bath, your shower, whatever it is that you like to do in the evenings. And then 20 minutes for some form of meditation, relaxation, prayer, something to help you land the plane, okay? Most people think that sleep is an on-off switch. It really doesn't work that way. It's really more like slowly pulling your foot off the gas and slowly putting your foot on the brake. There's a process that needs to occur there. For people out there, sleep should take some time, right? It should take you 10 or 15 minutes to fall asleep. If you fall asleep in less than 5 minutes, this is an indication that you're sleep deprived. This is not that you're some super great sleeper, by the way, although you might be a pretty decent one. There's a very high likelihood that you're sleep deprived, and that's why you're falling asleep so quickly.
Cool. I love it. There's just so many tips that we can incorporate into our lives to just get better. And just, it's almost like I'm really into not just wellness, but optimizing our health, right? So I think anybody listening, it's not just about making sure you pass your tests and your labs look good. It's about making sure you optimize yourself. So, and speaking of labs, I'm a doctor. So I'm like, what the heck, as a clinician, or what my, people listening, what should we be asking our doctor to measure in our blood to help us know where we are in terms of our sleep?
Great question. Great question. So unfortunately, there's not a lot of blood, quote, blood tests out there for
Hmm.
sleep, but there are some things that we can look at that can give us some very interesting indications. So I'm a type of person that I like to look at things like magnesium, iron, melatonin, and vitamin D. Those four things are
Hmm.
probably the most important when it looks at sleep. And so if I'm doing blood work on a patient, I'm looking for deficiencies. So I would have your magnesium. It's a very specific type of iron, by the way, called ferritin is very important because this has a very
Hmm.
direct relationship with something called restless legs syndrome. So for people out there, especially people who are seniors who find themselves that they get the jimmy legs at night, or they get the creepy crawly feeling, that drives them nuts. We always, always, always want to check their ferritin levels because with low ferritin, it looks like neuropathy. A lot of times, if we just give them iron sulfate, it fixes it right away. So that's kind of an easy fix. So I look for ferritin, melatonin, magnesium, and vitamin D. Those would be the four blood tests that I would run. To be fair, if I've got somebody who's an insomniac, I also like to run thyroid labs because we know that people with hyperthyroidism can have insomnia as a symptomatology, and people with hypothyroidism can also end up with sleep apnea and hypersomnolence. So we kind of have to look at all of those. So that would be the blood work that I would do. Rarely do I order sleep studies any longer unless I'm dealing with somebody with sleep apnea, which
Mm.
is pretty easy to
Okay,
see
gotcha.
and pretty easy to kind of figure out. Well, to be fair, because my specialty has a tendency to be a little bit more on the insomnia side, if you don't sleep well, dude, if I send you to a sleep lab and they stick 27 electrodes on you, put you in a weird place and have a camera shining on you, you're
Right.
really not going to sleep well. I can
Right.
assure you of that.
Right.
Like, we'll prove the point that we can make you an
That makes
insomniac if
sense.
that's what we're trying to do here. So those are kind of the tests that we have a tendency to run. And then in my practice, when I'm working with somebody, we do a lot of talk therapy. So we really look at habits and changing behaviors. While I work with pharmaceuticals, pharmaceutically induced sleep is different than natural sleep. Period. End of story. And to be fair, there's not a doctor on the
Hmm.
face of this earth that's going to argue with me on that point. Right now, I will tell you
Hmm.
that no sleep is much worse than pharmaceutically induced sleep. So I am not against sleeping pills. I am, however, would rather use them as a last resort. In addition, there are potential addiction issues that can come with sleeping pill use. There are also
Hmm.
all kinds of sorted problems that come with sleeping pill use. And in many cases, the pills don't work for very long. And I'd rather teach somebody how
Right.
to sleep. The data is very consistent. Something called cognitive behavioral therapy actually works better than sleeping
Hmm.
pills. It takes a little longer to institute, I must admit, but
Hmm.
it actually
Hmm.
shows
Yeah,
better sleep as well as longer lasting sleep. Unfortunate problem with sleeping pills is as soon as you
that's
take
good too.
somebody off the pill, they ain't sleeping anymore.
They not What about Trazodone? A lot of our seniors are
Yep.
put on Trazodone.
So let's talk about
Seems
the
safer.
controversy surrounding Trazodone because there is a little bit. So here's what we see
Hmm.
is in most cases of people who are seniors who are having difficulty with sleeping, most physicians have no problem doling out the Trazodone. So Trazodone is what's called a tetracyclic. It wasn't a particularly successful antidepressant, to be clear, and it doesn't
Right.
work great. But one of the
Right.
side effects that it does have is it makes people feel sleepy. And so what doctors are doing is they're using the side effect profile for this. And the good news is you can take 50, 100, 150 milligrams of this stuff, and it's not going to have too much of a detrimental effect one way or another. And we can keep people on it for extended periods of time without worrying about things like addiction. However, we're not treating the root cause of the insomnia. We're band-aiding it and just pushing people out with a pharmaceutical at that point. Now, are there some seniors that would require a pill to sleep? Of course, you bet. And do I have a problem with that?
Yep.
No. But what I would say is I think it's important for all of us as physicians to look at potential overprescription or overuse of some of these medications in times when we could, in fact, be taking less of a toll on the body and doing things more naturally. Great study that was done where they took 20 insomniacs, and these were hardcore insomniacs. They brought them to the woods, didn't give them their sleeping pills, and made them sleep there for 2 weeks. By the end of the 2 weeks, none of them had insomnia. None.
Whoa.
Right.
Whoa. That's saying a lot.
It
And I
is.
like taking people when you're a low carb doc, you take people off medicines routinely, and knowing that, and sleep is just a challenging. You
Absolutely.
know, it's more challenging. So just knowing that is very helpful. A lot of people struggle and they just think this is their life, but it doesn't necessarily have to be their life. So.
Yeah, and so one of the things that I do, so as an example, let's follow this path for just another second. Let's say we're walking down the path with a senior who's got sleeping difficulties, and we want to institute Trazodone. I don't have a problem with that, but let's institute good sleep hygiene methodology
Hmm.
along with the Trazodone, and
Right.
let's make sure that they're going to bed at the same time, waking up at the same
Hmm.
time, because the goal here is not to keep somebody on Trazodone for the rest of their lives. Of course, the goal is to break the cycle of the insomnia, educate the brain on how to sleep, reset the rhythm, and then move forward, hopefully without the intervention, right? I mean, that's always the goal of all physicians and all care is do no harm, right? And get people good. And so I think that's really,
That's right.
what we're
That's right.
talking about is it's okay to use Trazodone, but don't just use Trazodone.
That's right. Okay. Well, when a real couple of quick questions. As a low carb doc, I don't like talking about bananas, in any shape or form. Since the average banana has 28 carbs, but I do know that you have a hack that deals with banana
I
tea. Could you
do.
share that hack?
Of
Yes.
course. So many people do not have enough magnesium in their system. As a matter of fact, most people are deficient. Now, like I was saying before, you could probably eat a bushel of kale a day and
Hmm.
still not get enough magnesium. And here's why: is it our soil has been over-tilled, and what's happening is the nutrients and the minerals are no longer in those soils, and so
Hmm.
they're not coming up through the stalks of the what we're eating. So many people are requiring supplementation. Now, I get it. Some people don't like to swallow pills. Um, Turns out bananas, nature's sleeping pill, as we like to call them, are loaded with magnesium and carbohydrates. I get it. But here's the thing: take an organic banana, okay? And this is my recipe for what I call banana tea. Take one organic banana, wash it off, cut off the tip and the stem, cut it in half, leave the fruit on it, the fruit in it, and the peel on it. So you've got two halves of a banana. That's all I'm talking about. Drop them into 3 cups of boiling water and boil it until it turns brown. Then take the water, not the banana, but the water, and drink the water.
Mm.
Okay. So basically, it's
Hmm.
banana water, but it's got so many
Okay.
phytosteroids in it
Great.
and so many great things that help you absorb magnesium. And the peel has 3 times the amount of magnesium as the fruit itself does. So it's loaded with magnesium and it doesn't interact with anything, which is kind of cool. So you don't have to worry about side effects. You can take it as a senior, you can give it to
Hmm.
kids. I had one mom and she pours it into popsicle molds and she gives her kids popsicles during the
Mm.
summer made of banana water and it puts them right out. It's awesome.
I love it. I love it. Well, for my low carb followers, hopefully this wasn't too hard to listen to, and sounds like we can kind of manage to do this without
Absolutely.
lifting our blood sugar. So, real quick, REM sleep. I just want to, whatever you can say about REM sleep. It's such a common thing people hear. You got to get your REM sleep. Just tell me what you want to share about REM sleep, the
Of
importance
course.
of it.
So, when we're looking at REM sleep, there's a lot of interesting aspects to it. So, number one, we've recently discovered that during REM sleep, this is where we move information from our short term memory into our long term memory. So, it turns out that REM sleep is a very critical aspect to our sleep. Now, a few things that you need to understand is that both alcohol and caffeine have very dramatic effects on REM sleep. So for folks out
Mhm.
there, especially seniors that come to me and they say, I'm concerned. I could have a neurology problem. I'm starting to lose my memory. Could I have dementia? Could I have Alzheimer's? Very first thing I do is I say, let's get you to bed. Let's get you rested. Let's
Mhm.
see what's going on with your sleep first. Only then will we understand. Because if they're getting enough REM sleep, then we know that there's something else going on. 9 times out of 10, they're not getting enough REM sleep. When we teach them how to do that, the memory problems go away. So, to be fair, I'm not saying I'm curing Alzheimer's with REM sleep here, but what I am saying is that REM
Mhm.
sleep is very important in the memorial process. The other big thing that a lot of people like to ask me
Mhm.
about for REM sleep is dreams. So, what are dreams? How do they work? What's going on? So there's been actually quite a bit of research and discussion surrounding dreams, which has been quite interesting. But basically, dreams are the processing of emotion. So when we're trying to work our way through an emotional thing that maybe happened to us during the day, we dream about it and it helps us experience that emotion. The second thing that happens is the memorial component. So the memory of that emotion then gets logged into what we call our hard drive, if you will, right? So if this was my computer up here, it gets logged into my brain during REM sleep. So we need to experience it and then we need to store it. And those two things are what REM sleep does a tremendously good job of doing.
Excellent. So we're wrapping up, and I always want to ask my guests, you know, you know, what are you trying to achieve this year personally? And I think about my nest and rope acronym: nutrition, exercise, less stress, more sleep. How you think, avoiding trauma, and then relationships, avoiding pollutants and organisms that can harm us, and of course having emotions and life experiences that serve us. So when you think about those words and what they mean to you, what are you going to focus? What's your true north in terms of your health and what you're trying to achieve personally?
Well, here's what I can tell you. I heard a quote not too long ago from a guy named Jim Rohn, and he
Hmm.
said that you will
One of my
never be more
favorite.
yeah, you will never be more financially successful than the level of personal growth that you achieve.
Hmm.
And I
Mm,
believe that in my
mm,
heart of hearts.
hmm.
And so
Hmm.
my goal for this year, I've had a very good year. I started an institute of breath work. I now do breath work with a
Hmm.
group of men every single morning. I have a men's group that I go to now for self growth, where we talk about male related issues that I can't talk about in front of females. And I started my own meditative practice, which has been wonderful. And I got to tell you something, dude. Like, I wasn't a meditator at all. Like, I was like, this is woo woo
Right.
silliness. And
Hmm.
dude, it's
Hmm. Right. Right.
incredible how helpful something like this is. I mean, between the breath work, the meditation, and working with this group of guys, it has really opened my eyes to a whole different side of things. Stuff we didn't get taught in school, unfortunately, and how
Hmm.
important it is to
Yep.
the human condition. So I'm spending this year really focusing a little bit selfishly on me and my own self growth, because what I
Hmm.
have discovered
Hmm.
is that the better human that I can be for me allows me to be a better healer for those that I affect.
Well, I appreciate you bringing up that, and I definitely have not mastered meditation yet. So that's going to be part of. I had planned to be for last year, but I'm going to make it for this year. Haven't mastered it, so thank you for that little nudge. Where can people get your great resource? I know we're going to leave stuff in the show notes,
Yeah, yeah,
but what would you like to say for people to
of
reach out to
course.
you?
Yeah. So if people want to learn more about their chronotype, to know like when is the best time for sex and when to have alcohol or eat a cheeseburger or ask your boss for a raise or even sleep, go to chronoquiz.com. But if you want generalized sleep information, my website is the easiest place to go. And it's very simple to find. It's just the sleep doctor, and it's all spelled out.com. So thesleepdoctor.com. You will find out more about sleep there than you've ever imagined, I can assure you.
That's right. Well, I appreciate you, Dr. Bruce, and I really want to thank you for all you're doing out here to help people sleep better. And thank you again for being here. And I just love it. So I personally have benefited from focusing on sleep and think, all the people listening will do the same. I encourage each and every one of them listening or watching to prioritize sleep this year because it's a critical piece to helping us all achieve our goals, be it health, professional, even just having the energy to be a great dad, a great spouse, or even a friend. We need to get enough sleep. So now you know just a little bit more how to protect your nest by focusing on sleep. And I'm so thankful, Dr. Bruce, for you sharing your insights today. So thank you again for being here. I appreciate you. Make sure you guys check out those YouTube videos. And as we wrap up, any final thoughts, Dr. Bruce?
Just to remind everybody, consistency, consistency, consistency.
Yes, I love
If,
that.
if all you do is just wake up at the same time every day, including the weekends, your sleep will get better. I promise.
I believe that. I've experienced it personally. So if everybody listening, be well, be safe, and continue to protect your nest. And thank you for tuning in today. Take care.